Dear colleagues, in this short video I will show you an introduction into polarity analysis. That is the place from where I speak to you. It is our practice in Laupen, in a small town near Bern, the capital city of Switzerland. Here you see the environment. Our practice is the place where polarity analysis has been developed about 20 years ago. Now, what is polarity analysis? It is a repertorization method based on Bönninghausen's therapeutic pocketbook. And it allows precise and reproducible remedy determinations that increase the success of prescriptions by calculating a healing probability for each remedy. Polarity analysis is the result of 30 years of research aimed at improving the precision and reliability of homeopathic remedy determination. Its breakthrough came during the Bernese ADHD double-blind study. You see here on this graph, the blue line is the entries into treatment, the patients who entered homeopathic treatment in the study, and the green line shows the patients who reached an improvement of 50% of their symptoms and thereby the eligibility for the double-blind trial. And when we look at the first 9 months of this curve, you see that if we would have continued, the two curves just separate from each other, and it would not have been possible to make a successful double-blind study. At this point we introduced polarity analysis, and you see how immediately this curve began to rise steeper than before, and it is really the method that enabled us to show a significant effect of homeopathy in ADHD. How does polarity analysis function? It focuses the repertorization on reliable symptoms, that is, especially modalities and polar symptoms. They are what is really characteristic about a disease. Now, in our software, we divided the symptoms of Bönninghausen's pocketbook into 3 reliability criteria. We have symptoms that have a high reliability, others with an intermediate reliability, and also symptoms with a low reliability. And you see there are only very few symptoms that really have a high reliability. It is 6% of all symptoms. 34% of them have an intermediate reliability, and 60% of the symptoms have a low reliability. So it really matters that you make a repertorization with highly reliable symptoms if ever possible. Highly reliable are, as already said, many modalities and polar symptoms. They are marked in the software with a green color. Intermediate reliability have most localizations and physical findings. They are marked yellow in the software. And symptoms with a low reliability are those that are subject to an interpretation. They are marked with a red color in the software. Now I show you a practical case. It is about a 3-year-old girl, Vivienne, who suffers of severe pain when swallowing, has a coryza, cough and high fever, 39 degrees Celsius. And she's apathetic, complains about abdominal pain, does not want to move, eat or drink, and dislikes to be touched. She has already received an antibiotic 3 days ago in an emergency clinic, and the effect of the antibiotic is that she has a diarrhea and nothing has improved so far. Vivienne is pale, has dark rings around the eyes, and her tonsils are swollen and covered with a white membrane. The cervical lymph nodes are enlarged, tender to touch and pressure, and the spleen is slightly enlarged. Our laboratory examination confirms the suspected diagnosis of infectious mononucleosis, glandular fever. And now the mother prepares with the checklist for reliable symptoms the additional informations we need, namely the modalities and polar symptoms. Here you see the checklist. The parents can download it from our website and already prepare it at home. If they haven't done so already, they will do that in practice. From this checklist we get the reliable symptoms of Vivienne, that is the pain on swallowing, swallowing aggravates, pain on external pressure, on touch, movement. She doesn't like to stand, she doesn't like to uncover, and she has an aggravation after sleep, and her salivation is increased. All these are very characteristic symptoms of her disease, and so we use all of them for the repertorization. Here you see our repertorization. These here, between the red and the blue line, are the patient symptoms we just saw. Below the red line you find the opposite polar symptoms. All these symptoms here are polar, that means they have an opposite. Like swallowing aggravates, swallowing improves. Pressure aggravates, pressure improves. Touch aggravates, touch improves. What we do in polarity analysis is we add the grades of all polar patient symptoms and subtract the grades of all the opposite symptoms. The difference shows us the specificity with which a remedy covers the patient's symptoms. With other words, the polarity difference I can explain that in another way. We can say that all the grades up here are an argument for this remedy, and all the grades of the opposite side are an argument against the remedy. And the difference between these two shows us the healing probability, the polarity difference. Here you see we have quite many remedies that cover everything, but we have hepar sulfur as an outstanding remedy in this case. So Vivienne receives 1 dose of hepar sulfuris. 2 hours later she begins to play again. After 4 days everything is much better, no fever, no pain anymore, but she still coughs and has a rash around her mouth. So we repeat another dose of hepar sulfur, and we make a follow-up examination a week later, and everything is normal then. To appreciate the course of this disease, it is important to know that infectious mononucleosis usually lasts up to 12 weeks. Now, what is special about this case? In traditional homeopathic schools, we learn that we have to use all symptoms of the patient for repertorization. In polarity analysis, we only use the most characteristic symptoms, the ones you just saw. And our constant experience is that the resulting remedy covers also the less specific symptoms that we didn't include in the repertorization. Now, if you introduce a new method in homeopathy, you should, before making it public, make an evaluation if this method functions well. And we did that. We made several studies. One was in acute disease. And to make an evaluation, you need to define outcome criteria. Our outcome criteria were first hit, cure within 2 days with the main remedy, the first remedy applied. Second hit, cure with another remedy 2 days later with a reserve. The other remedy, the reserve remedy, the parents receive along to take home in case the improvement of the first remedy would be less than 50% after 2 days. And the third criterion is no reaction, neither the main nor the reserve remedy cure the patient. We applied these criteria in 256 acutely ill patients. And you see we have 56% first hits, we have 31% second hits. That means 87% of the patients are cured within 4 days, and in 13% we have no reaction. We also tested polarity analysis in the most complex patient, the multimorbid ones. Multimorbidity is defined as a simultaneous presence of 3 or more chronic disease. And our outcome criteria there were a monthly rating of improvement of each disease by the patient in percent. And we considered an improvement of 80% globally after 12 months as a successful treatment. Here you see the improvement curve. We had 50 patients in this study. 43 of them could be successfully treated. 7 were dropouts. And you see after 1 month we have an average improvement of 46%. After 2 months it is a little over 60%, and after 12 months we have 91% improvement in the successfully treated patients. What are the preconditions for success? The patients must learn to observe their symptoms. This is extremely important. And we have these checklists I showed you to facilitate this, and they can be downloaded from our website. The patients can already complete them at home before the consultation, or if they haven't done so, they will do that in practice. It is very important that our patients know that they are a partner in the treatment who has to contribute to their cure by precise observations. How do we know that we have a best fitting remedy? Polarity analysis is like a puzzle in which the symptoms must fit together. If they do, we will have a high polarity difference for one remedy. If they don't, you get a flat distribution of polarity difference values. That means none of the remedy is outstanding, all have relatively low polarity differences. If you find a flat distribution, you must look for wrong symptoms in the repertorization. Symptoms that have not correctly been observed or or were subject to a wrong interpretation by the patient. If we eliminate them, usually we end up with one remedy that is outstanding. When you start with polarity analysis, it is wise to begin with the treatment of acute disease. Don't mix polarity analysis with other methods. That is a way that rarely functions. And observe your outcome, your results in a protocol, and by that you will get confidence in the method. The consequence of polarity analysis is that it sharply decreases the difficulties in finding a correct remedy. For a novice, homeopathy is like a huge mountain to climb, and it is very difficult to get into it. If you start with polarity analysis, this mountain is much smaller, and with the method you can successfully treat 85% of your patients. We will show you in further videos how a practical case-taking functions. We will also show you how to make a correct case analysis, and we will show you how to master difficulties. In the end, we will also introduce you to some important outcome studies. So that is the end of this first video. Thank you for your attention.